Hi there, and welcome back to this week's episode of the Delivered Podcast. I'm Athena Estelle, and on this week's episode, I am so excited to bring back one of my favorite guests. Dr. Mera Keenan is the beloved OB that delivered our daughter, Cecilia, and she's just one of those people that you meet her, we had an instant connection. She was so supportive throughout my pregnancy. She has been on a prior episode of the podcast, and we have just stayed in touch, and it's been lovely. She's now a mom of two, and her specialty currently is she is an OB in an OB outside of DC. So super busy hospital. She's going to fill us in about that and more. So welcome, Mera. I'm so glad that you're here.
Hi, Athena. It's so nice to talk to you again, and thank you for the lovely introduction.
Oh, thank you. I never want to get it wrong, when you have to think about it and just talk a little bit slower to make sure that you capture it. But thank you. So for those who don't know, explain to them what exactly an OBER is, which I guess it makes sense when I say it, but give some more information about that because I don't believe we have one in Jacksonville.
Yeah. I'll start off by saying how I came to meet you and family, and then I'll tell you a little bit about my current position. So as Athena said, I delivered Cece. I was, at the time that I met Athena, I was in private practice in Jacksonville. And so I worked in the office as well as at the hospital. A couple months after Cece was born, I moved to the DC area where I currently work as a hospice and OB hospitalist in Northern Virginia. And so I do deliveries, I do C-sections, I supervise residents, but primarily I'm in the OB emergency department, taking care of pregnant women who have urgent concerns and also postpartum.
That's awesome. When you say urgent concerns, I immediately think like preeclampsia and blood pressure and things like that. What are some other things that you see on a common day for you?
Yeah, great question. A variety of things, really. I mean, the majority of them are pregnancy related, but some are non-pregnancy related too. So the common things that we see are things like rule out labor. Women come in who think that they've broken their water, decreased fetal movement, but other things too, like women coming in with chest pain or abdominal pain that doesn't seem like labor. Pregnant women can get appendicitis and cholecystitis, which is infection in the gallbladder as well. So I've taken care of women with neurologic issues too. So we work closely. We're part of the same system. We're actually in the same building as the adult and pediatric emergency departments. And so we work closely with them for these non-obstetric concerns. Other things that we see are bleeding at any point in the pregnancy or heavy bleeding postpartum. Yeah, you mentioned preeclampsia. Preeclampsia is a common one, or concern for potential preeclampsia. Those are the most common things. Also, women who have been in a car accident or have had a fall, things like that, they'll come in for monitoring.
Okay, that makes sense. And I think that probably is, comparable. It's like the OB version of the ER. So it's probably like ever changing. You're seeing new things, you're experiencing new things. It's probably nice to have all those different moms and families to interact with.
Yeah. I definitely interact with a wide variety of people from different backgrounds, different languages. Just the area that we're in is a very diverse area too. So we use the translator line a lot because there are lots of different languages here. Yeah, and people from all different backgrounds. So I see, patients that don't have insurance, that don't have any prenatal care at all, but also patients that have been going through fertility treatment and who have had prenatal care from the very beginning. So yeah, it's neat to interact with such a diverse group of patients.
Yeah, I love that. Because then it's ever changing. How could you get bored? Like, you can't. Yeah.
Yeah,
that's really cool. Yeah. So I thought it'd be cool on this episode, which we've talked a little pre-recording, just to go through. There's a lot of common questions that moms will have, either while they're pregnant or after they deliver, and just different things of, is this normal? Is that normal? And I thought it'd be really cool to go through that with an OB expert like yourself. So, all right, the first one, I feel like I hear this a lot, is after women have the baby is you're obviously so excited, you're on a high, all these wonderful, happy emotions. But then also there can be a side note of like sadness and adjustment and things like that. So when you have moms that are going through that and they're kind of questioning, like, is this normal? Why do I feel this way? How do you address that with them?
Sure. Yeah. I mean, that's extremely common. I would say I haven't met somebody who hasn't experienced that to some extent. So, first of all, I would say that you're not alone. I mean, a lot of people feel that way. A lot of women feel that way. Everyone's situation is a little bit different. So, I think some women have preconceived notions of what motherhood will be like. And, I think a lot of women think that, especially if it's your first kid, that it's going to be such a wonderful, beautiful thing being a new mom. And there are a lot of challenges, a lot of sleepless nights in the beginning, a lot of anxiety about is my baby going to stop breathing in the middle of the night? Or like, why is my baby crying? Why can't I get them to stop? Every kid is different too. Some babies are just crying all the time and difficult to calm down, and some are super chill. So I think, but overall, I think a lot of women have certain expectations, and oftentimes the reality is different from the expectations that you have. And so, yeah, it's a very special thing to be a new parent, but also it's really hard. And I think it's very normal to feel like you're not doing a good job. You might feel that way multiple times a day. I think a lot of women, a lot of parents do, just because there's always going to be something to make you feel like you're not good enough as a parent in some way. And some people feel that more than others, obviously. But yeah, so I guess the way, going back to your question, the way I would address that is normalizing it, because that's what it is. It's normal. It's okay to feel that way. And, for some, that can be those feelings, especially the negative ones, the feelings of being overwhelmed, being sad, those, if it gets to a certain point where it's really impacting your ability to care for yourself and your child, then at that point you need to talk to somebody and get some help navigating that. But it's very common to feel that, especially in the beginning.
And then you kind of gave me like a perfect little segue right there. Thank you. So when you think about the baby blues, as I feel like is used, pretty commonly in the postpartum community, if a mom said to you, like, how do I know if I have the baby blues or if it's postpartum depression? How would you kind of help them either differentiate the two, or do you think that baby blues can kind of lead into the postpartum if it's not managed?
So sometimes it is difficult to distinguish them, especially if your symptoms are not severe. Sometimes it's obvious, but I would say more often than not, it can be hard to distinguish what is what. The baby blues usually start within the first few days after delivery and usually are short lasting. So maybe a couple weeks, a few weeks. And the symptoms are usually not severe, but symptoms of feeling overwhelmed, sad, tearful, anxious. If you ever have symptoms like that, but that are more severe, especially postpartum depression and anxiety usually is longer lasting than a couple weeks. So, and more, the symptoms are more severe. So if you, for example, feel like you're not able to get out of bed, or you hear your baby crying and you're not able to get yourself, get up and feed them and do things to take care of your baby and yourself, then you might be dealing with postpartum depression. So, like I said, a lot of the time it is difficult to distinguish. And if you have any concern that it might be more than baby blues, then you should talk to your OB provider about it. And they will let you know if that's kind of within their realm of what they're comfortable managing, or they might refer you to somebody like a psychiatrist or a therapist.
I felt like for me, because I was fine in the beginning, I was like smooth sailing, floating. I mean, she wasn't eating great. She wasn't gaining weight. So we had smaller issues, but me personally, I was doing fine. And then I feel like the helmet really derailed me. But the thing when I noticed, like, okay, I'm really not okay, was I felt like I didn't want to do basic daily things. I did not want to shower, which sounds so gross. I don't even like saying it because I'm a very clean person. And I probably sound like just gross, but like, no, girl, I had no desire. I was just like, I don't even care. I don't want to change my clothes. I didn't want to walk the dog, which is bizarre. I walked that dog. Like my neighbors know, they literally see me every single morning between 6:15 and 6:30. These people be seeing me. Okay. So that was weird. I had no desire to eat. Again, I'm Greek. I love to eat. So I also think if they're not doing things that they were doing, maybe not the consistency that they were doing pre-baby, because obviously that's very hard to regain. But I feel like if they lose a desire just for those basic functions, then that's also a sign.
Yes.
You need to speak up.
Yes, absolutely.
Yeah. Yeah.
And it is a little bit atypical, your experience, in that it appeared later. I mean, more commonly it's postpartum depression and anxiety develop pretty immediately. Sometimes it's not diagnosed until later on, just because I think a lot of families brush it off as, oh, this is a major transition in my life, so it's normal for me to feel some of these feelings. But yeah, your experience was atypical in that regard.
Mm-hmm. Yeah. Definitely never something I thought I would deal with, you know. I've said that.
Yeah. Well, I mean, knowing you, and we got to know each other well while you were pregnant, it's not something that I ever was worried about for you. There are some people who I worry about that more for. But I remember I didn't, because I moved and a couple months after Cece was born, and we didn't really keep in touch at that point. And I remember the first time I knew about your experience was when you started the podcast. And I was shocked, honestly. I wish that I could have been there too for all of that to help you through it. But yeah, so you're never somebody that I was concerned about.
The ironic thing is that it was COVID when I was pregnant, so everything was canceled. They did like a hybrid hospital tour parenting class, which we took. And I remember when they talked about postpartum depression, I kid you not, we got in the car and I like chuckled to Chris and I was like, I would never get that. What are the odds? I would never. And I remember looking back and being like, it just literally goes to show you that, number one, behind closed doors, you never know what someone could be going through.
Right.
And number two, postpartum depression, anxiety does not discriminate.
Right.
So those chemicals, those hormones, it can happen to anyone. So I love and appreciate all the happy, high energy moms like myself, but just being aware that it's possible is a good outlook for sure.
Yeah.
So yeah, that was a good one. I love that. Okay. Now what about the sex thing? So obviously different for vaginal compared to C-section, but generally say someone has a typical safe labor, no complications. So just like a blanket broad. What is your guideline on returning to safe sex? And for the moms that might say, I'm having pain now, I never had pain before, how do you kind of guide them on the biologic side of that?
Yeah. So usually you'll see your doctor, your OB doctor, at about 6 weeks postpartum. And that's when they do an exam. They make sure everything is okay for you to return to having intercourse. And so usually it's 6 weeks. And that's actually true for C-section and vaginal delivery. Of course, if there are complications, if there's a bad tear, or if you're having, persistent pain or something like that, wait longer. There aren't any specific guidelines as to exactly how long you should wait. But basically what I tell women is if they're feeling at 6 weeks, if everything looks normal, everything's healed, they're feeling up to it, then absolutely go ahead.
Okay.
Now, for women who have pain after delivery, whether or not they had it before, depending on if it's pelvic pain, let's say they try to go back to having intercourse and they have a lot of pain, I would tell you see your OB again, because that may mean that you need to do pelvic floor physical therapy. It may mean that you have tissue kind of scarred together and maybe the opening isn't what it was. You can have pain for a variety of reasons. Sometimes infection can be the cause of your pain. So I would see your OB first. And let's say although this isn't recommended, let's say you try to have intercourse right before your 6-week visit and it's painful. Tell them that.
Okay.
Tell your OB that. And they'll do an exam and they'll let you know what they think. But oftentimes, if there's no physical abnormality that we see, then we would refer you to a pelvic floor physical therapist. And you can be referred to a pelvic floor physical therapist for other reasons too. That was one of the questions that we were going to address. For example, a lot of women have urinary incontinence after having babies, and that can be kind of temporary. It can be more long lasting. And that's true after a vaginal delivery and C-section, actually, even though it doesn't make sense to a lot of us. Why would you didn't push a baby out if you had a C-section? Why would you have incontinence? But it's possible. So if you're having this ongoing issue, tell your OB about it. There can be different causes of having urinary leakage. So, but after having children, the most common cause is stress incontinence, which is where you leak when you sneeze, you cough, lifting sometimes causes it, or running. So that kind of issue can be addressed with pelvic floor physical therapy, and they can help you strengthen those muscles. And there are other tools that they have that they can help, diagnose what kind of issues and what therapy to best address that.
Mm-hmm.
Have you ever
Yeah.
worked with pelvic floor physical therapists?
There's actually a couple that I graduated with in my class. They do pelvic floor now. And then I had a girl on the show from the Northeast. She's a pelvic floor physical therapist. It's very niche. I've had an opportunity to try it in the past. A clinic here asked me about it for a job. And I don't know why it just, I can handle like the anatomy and the body parts, and that is fine. But I feel like it makes me nervous because if you think about our bodies, like as a PT, if I'm going to rehab someone's shoulder, that's a huge joint. Like it's very visual. You can see everything, all the things. Your pelvic floor, for those of you who don't know, it is tiny. Like these muscles are maybe double the width of shoestrings. It's all very intricate. And so I think just because it's more detailed, it makes me more nervous because I want to help fix them and make them better. And if I don't, then I feel like they'll be disappointed.
Mm-hmm.
So it is definitely, I always say that's the one realm of therapy I have not embarked on, but it's honestly, it's like booming. I mean, we've got a couple really good clinics here in Jacksonville. The one that a lot of my friends, patients have gone to is called Smart Body. People are in love with it. I'm sure you've heard of it from being here. Yeah. There was a time when I had a little concern about the stress because I'm a runner, not a serious runner, like a 5K, 10K runner, but it was interesting. I would notice if I did not go to the bathroom right before I ran, immediate, I would make it a mile into my run and be like, oh, I have to stop or I'm going to have a flood, And I think pelvic floor would have been the answer, but I'm prideful and I'm a PT and I was like, I'll figure it out. But yeah, pelvic floor is wonderful. Absolutely. I know they deal a lot with pelvic pain, how you mentioned, and between exercises, there's little machines that they use in office. There's personal ones you can buy at home. So yeah, it's a great tool.
Yeah.
Yeah. All right. So for those moms that have a lot of fear that if they speak up about the postpartum anxiety, if they speak up about the postpartum depression, it's not very common that I've been asked this, but I have in the past, is moms are concerned that either the Department of Children's Services will get notified that potentially their child could be taken away if they feel like they've done something wrong and the system does that. But if you have a mom that's coming to you about that, how are you reassuring them this is normal? It's a mental condition. Your child is yours. They're not going anywhere. How do you approach that?
The priority is always making sure that you're healthy and the environment is safe enough for you to care for your child. The priority is always going to be keeping mom and baby together. I would say if your symptoms are very severe and if you see a healthcare provider and they think that you need to be admitted to the hospital, of course, that's for the safety of you and your child. The priority is getting you well enough so that you can be reunified with your child. So it is very, very, very unusual for your child to be taken away. And most of the time, if that happens, it's a temporary thing. The vast majority of the time, everybody's priority is to make sure that you're well enough to be able to take care of yourself and your baby.
Mm-hmm. Yeah. And I feel like the couple times I was asked that, it just broke my heart because I think I was just way too far gone mentally to even be concerned about that. And I do have a supportive partner, like thank God for him. But just hearing that, I don't know, it broke my heart because I think that right there is just proof of the stigma that just is like the black cloud over postpartum depression because if you had a broken arm, are you not going to go to the ER and have surgery? It's like temporarily with the postpartum and the anxiety, it's like your brain's just broken. You
Yeah.
just need a little brain therapy. You know what I mean? Yeah, it broke my heart to hear that. I'm glad that you can help reassure them as well that the goal is to keep mom and baby together always.
Yeah. And I mean, unfortunately, as you alluded to, there are barriers when it comes to mental health. Well, in general, but, specifically because we're talking about postpartum, there are barriers to getting care, multiple. And I think that for some is one of the big barriers. I don't want to speak up because I don't want to make the situation worse for my kid. I already feel inadequate because I'm compromised. I'm having a hard time. But then you don't want to make things worse by having your child taken away from you. So it's really unfortunate that that is a barrier for some people. And I think we need to do a better job of educating patients about that. Since I've been practicing, we have been more consistent with doing postpartum depression screens, both during pregnancy, multiple times during pregnancy, and usually in the hospital before you go home. And then your OB usually does it when you go for your postpartum visit. And my pediatrician's office does postpartum depression screens. It feels like almost every visit for the first 6 months. So, or maybe more. We've gotten a lot better at doing those screens, but I think for some, that's not enough. And for some, yeah, you might be worried. It's pretty obvious on those questionnaires. Oh, here's what I need to answer in order to make it seem like everything's okay. So it's easy to bypass those if you want to.
Mm-hmm. Yeah. And I feel like it all ties into just the fear of failure. You're failing your baby, you're failing yourself. And so it's kind of like, how are you reassuring those moms that you're not failing? You're doing the best that you can with the tools that you have. And especially for the first time moms, it's like you're learning on the fly. Who has the instruction manual? If there is one, I would love to have it. But it's kind of just like, how are you reassuring them that they're not failing, that it's just parenting? I don't even know how. What are you telling them?
Well, first of all, you're going to feel like you're failing maybe multiple times during the day. Some days are going to be harder than others. And that's totally normal. And I think everybody that I've talked to at some point feels that way. When it comes to recognizing, oh, this is postpartum depression, I need help, I think a lot of women feel like that making that admission is failure. And what I would say is it's actually the opposite. It's not failure at all. It's our obligation as parents, our responsibility is to make sure our children have a safe and supportive environment to grow up in. And it's at some point that's not possible for everybody. Everybody has a different situation. But if you get to the point where you're like, I can no longer provide this, I need help, then it's actually a strength coming to that realization and being able to open up about that. And so I would say it's not a failure at all. That's the ultimate goal. And the ultimate aspiration is to make sure that your child is safe and has the things that they need. So I think our culture maybe doesn't see it that way. And that's unfortunate, but we need to do a better job of changing that. And I really love that you're doing this podcast because I think that's accomplishing that, normalizing. This is something that a lot of women deal with. And even women who you don't think will deal with it, they do. A lot of people are ashamed to talk about it, but I love what you're doing. I think it's helping a lot of women.
Thanks.
Thank you.
Yeah. Oh my gosh. No, thank you. I just think, it's wild though. Exactly what you said. It's like, first of all, you don't know until you start talking about it. But then it's like the amount of people that I've had reach out, friends, strangers, but the friends that I've had reach out that are like, oh my gosh, I felt that exact same thing. And like the minute you said that, da 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 da. And I'm just like, wow. When I was in it, I wish someone would have had the strength to say like, it's going to be okay. You'll be on the other side of that. And I love that you said strength because I think you never realize how strong you are until you go through something absolutely awful, whether it's the death of a really close family member or your own personal trauma or depression, anxiety, whatever level of trauma it is. It's almost like it's the same thing I've said. I feel like a broken record today, but it's like if you would have told me 2 years ago, I would have started a podcast and been back to working and just been living life vibrantly. I literally probably would have cried and laughed in your face and been like, no way. There's no chance. Because I think when you're in it, it's so all consuming and it's hard to pull yourself out of it. But I feel like, especially with this, it's like you almost have to force yourself to ask for help because you're never going to know if you don't try, you know?
Yeah. Yeah. And sometimes it's a gradual process and you don't realize you need help. You don't realize how bad it's gotten until you take a step away from it and you talk to professionals and you start to recover.
Right. Okay. I want to finish with this one because I think this is important. So, for the moms that are maybe currently pregnant or have recently had the baby, they do plan to return to work, which I know both of us have lived through this. How do you encourage them just with that transition? Either focusing on things that they can do to make it easier or ways to mentally prepare themselves to be going back to work, or in your own personal experience, what has worked for you to help that transition?
Yeah, I think one of the things, honestly, that helped me the most is just talking to my colleagues and friends who have been through that experience and kind of mentally preparing for, okay, this is going to be hard. I'm probably going to cry on my way into work the first time, and that's totally okay. I personally felt ready to go back to work after my first pregnancy. So I felt as prepared as possible, but I still cried when my son was crying when I was on my way out of the door, and I cried all the way to work, and then I got myself together and it was actually good to be back at work. So it's an emotional roller coaster. And I think just being mentally prepared for that, and you might not have that experience at all. You might not cry at all, which when I went back to work after my daughter, who's 6 months old now, I was totally fine. I was like, a little sad to leave the house, but it really wasn't the same emotional experience for me. So, I don't know that I have great advice other than maybe talking to other people who have been through it if you can. If not, just being prepared for a range of emotions. I think it's also common for women who go back to work after having kids to feel guilty about it on some level. I can tell you that I felt like I love going to work and I love what I do at work and having my family when I'm at home and spending time with them, but also being able to work that is fulfilling to me. But there are also times I feel guilty about sending my kids to daycare. There are times I frequently wish that I could spend more time with them. I sometimes work weekends, I work nights. So, I wish that I worked less of those things. Yeah, it's normal to feel guilty too, but just remember that you'll figure out what works best for you. And everyone's in a different financial situation too. So obviously that plays into it. But I think do your best to find that balance where you find fulfillment at work, but also can spend the time that you want with your family. And if it gets to the point where you really aren't finding that and it makes you unhappy, then try to make some changes so you can. Yeah. And also, again, talking to other moms who have been through something similar, I feel that really helps tremendously. At least it did for me.
Oh, yeah. The guilty thing resonates with me because it's one of those things where, exactly like you said, it's like, I love my job. This is what I wanted to do. So I'm happy to go to work. It's an interesting shift, but I also think it's a big part of your identity. And, if you enjoy your job or you need your job at that moment financially, then I agree with what you said, finding people that are like-minded and supportive because, that's just the current situation that you're in. So not placing guilt on it, but also just kind of embracing that this is where we are and trying to enjoy it as much as you can.
Yeah. And I think too, with the internet, I think it's easy to find places where you feel shamed about having a career and having other priorities. So just surrounding yourself by people that are supportive of what you're doing. Yeah.
That's a great way to put it. So now that you're a mom of two, I'm going to ask you my favorite question. So just kind of thinking about your motherhood journey and, starting with Corbin and now with Sloan, what would you say if you had to sum it up, one word or thought about it? How has it been going for you?
That's hard with just one word.
Or a slogan or a few words.
A few words. I don't know if I can do it with less than how about a couple sentences?
There you go. Yes. Lovely.
It's life-changing in a good way, but there are also challenges.
Mhm.
Every child is different too. And so I think that's more than a couple of sentences,
That's fine. Keep going. You're fine.
but I think part of one of the challenges is you might see moms around you that have easy kids or that on the outside or seem like they have everything together. Nobody has everything together when it comes to parenting, you know? And so my son, for example, was like such a challenging baby and I didn't know anything different. So when my daughter came along, my expectation was like, oh my gosh, this is hard. Having a 1.5-year-old and a new baby, it's going to be really hard. And it was, but she was really chill. And I think my expectations were it was going to be a lot harder than it was. But some women have the reverse experience. They have a really calm baby the first time. And then if they have another that, you know, if it's a challenging baby, their expectations are different. And so I think when your expectations you think things are going to be easier than they are, that is more difficult. So, and we weren't sure that we wanted to have children. So I can't imagine my life without them. Having kids isn't for everybody, but it's so special. Your priorities become different. I don't know how, I guess I had all this free time before I had kids that I didn't know about.
Yes. There's like those two memes. The first one that you as you were describing all that, the first one I thought of was, have you ever seen the one that says parenthood? And it's like the most rewarding, exhausting, and exhilarating journey you'll ever take. And I was always like, okay. And now that I'm living it, I'm like, got it.
Yeah, you hear people say that, and it's hard to know exactly what that means until you're in it. But yeah, I mean, I would agree with that 100%. So
crazy special. Yeah,
yeah,
absolutely. Yeah. Well, I'm just so glad we got to do this again. You have been fantastic.
Yeah, me too.
Yeah.
It's really
Thank you so much for your time.
Of course.
All right, girl. Well, we'll talk soon.
Okay.
And thank you, everyone, for listening. We'll catch you next week.